Hello, 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 everybody. Welcome to my channel. I'm Dr. Perkins, a board certified OBGYN. And today we're talking about what antibiotics treat bacterial vaginosis. By the end of this video, you will know exactly what is bacterial vaginosis, or BV that we say for short. We will talk about the first line treatment for bacterial vaginosis, as well as all the different alternatives that are available to you. We will talk about partner treatment. Now, this is hot on the press because prior to this, we've heard so much about bacterial vaginosis being a female issue. Males have no part to this and do not need treatment. But I can tell you that as of 2025, that has changed. And now partner treatment is available. And so we'll dive into that. And lastly, we'll talk about tips that you can do to avoid or reduce recurrence of BV. So let's tag along. All right, so bacterial vaginosis, or BV. I can tell you that as an OBGYN, this is probably one of the most common infections next to yeast infections that we see in the office all the time. And sometimes what's most distressing is the fact that some women have these infections over and over and over again. And it seems like it's just never ending. You can't do things right. You can't take enough antibiotics. It just always recurs. And so I understand the frustration that surrounds this. I know you don't want to be in the office, in our offices, all day, every day. And we don't want that either. And so I'm going to dive into what it is, some of the things that you can do to reduce the likelihood of this happening, but really talk about the importance of antibiotics, what they are, and those options. And so what is bacterial vaginosis? It is an overgrowth of bacteria that naturally is found and lives in your vagina. This is very different from if you were to get like an ear infection, which you have a bacteria that's growing in your ear canal that is not normally supposed to be there, and now you need antibiotics to get rid of it. In the vaginal space, we have lots of microbes that lives there. And they all are there to support the well-being of your vagina. It helps to maintain the lush and beautiful place that it is. And so bacteria isn't necessarily a bad thing. But whenever you have bacteria that overgrows, that means that if you were supposed to have 100 of this type of bacteria, you may have 200 or 500 or 1,000 of it. So it's just too many of this, and it causes an infection. It's hard to talk about bacterial vaginosis without also mentioning pH. We talk about pH imbalances. It is a very common term, but what it means is that vaginas like to be acidic, or blood, for instance, is more neutral, around 7.2, 7.4. Semen, if we were to bring semen into the picture, semen is alkaline. So semen is on the other side of the spectrum, wherein it's very basic. And so what happens is that if vaginas become less acidic, meaning they move closer to neutrality or even more basic, what happens is that that environment causes an overgrowth of bacteria. And so it is one of the easiest ways that we can get BV. Whenever the vagina is less acidic than it ought to be. Know that anaerobic bacteria, this group or classification of bacteria, is typically the ones that cause bacterial vaginosis. It is not always the same bacteria. It is not always the same species of bacteria, okay? But what we do know is that anaerobes tend to cause this problem. That is a part of the reason that if you do think that you have an infection, that it's important to get testing, because that testing will tell us exactly which one of our microbes is actually overgrown, causing the symptoms that you're having. And those symptoms may look like gray discharge. It could be that you have vaginal irritations. It just doesn't feel normal down there. Sometimes it could be that you have a fishy odor with sexual intercourse. There is something about the friction or the activity within the vaginal canal that allows the anaerobes or the bacteria to release that fishy odor. And so some people may have bacterial vaginosis and not know it because they don't have any symptoms whatsoever. If you fall in that ballpark, it's okay. This is another reason why testing of our vaginal space is important. It gives us lots of information. Now, if you get this diagnosis and you now know that you have bacterial vaginosis, the number one gold standard treatment is metronidazole. Metronidazole comes in a couple of different forms. So you have the pill, and that is called Flagyl. And oftentimes you will take it for about 7 days. While you're taking this medicine, it's important that you don't drink alcohol. Okay, so that's the first thing that I want you to know. Do not drink any form of alcoholic beverages while you're taking this, because the sickness that you get physically, the nausea, the vomiting, the abdominal pain, is not worth taking the alcohol. So because of that, it is an absolute mandatory part of your treatment. Now, a second form of the medicine comes in a gel form called Metrogel. The gel you'll have to place vaginally. So the pills, Flagyl, you take by mouth. Metrogel, you place and insert vaginally. As far as efficacy, they both work just as well. Some people just don't like taking pills, and some people don't like putting anything in their vaginas. And so it's a matter of preference. Both will treat the infection quite well. Now, an alternative is clindamycin. Clindamycin is another antibiotic. It attacks anaerobes just as well as metronidazole does, and it comes in different formats as well. You can take it as a pill by mouth. You can have it as a pill as a suppository, and it's available as a cream as well. Clindamycin is just as effective. However, while you're using it, it's important to know that if you do have sexual intercourse and use latex condoms, they might not work as well. They meaning the condoms, that is. The pills and the clindamycin will still do its job just fine, but it does decrease the latex in the vaginal space being able to maintain its integrity. And so condoms may break. Another alternative medicine is secnidazole. In general, you may notice that metronidazole, secnidazole, they have like a very similar ending. Azoles are really good with treating these types of infections. Now, with this medicine, secnidazole, it is a one-time dose. It's like granules that you will take with your food, and essentially it is very effective and clears the infection altogether. A fourth option is tinidazole, again, another azole that works really, really well with taking care of these infections. Now, understand there's a reason why there is a first-line gold standard treatment. Usually we're thinking about tolerance, meaning that you take the medicine and you have less side effects. All of these things are factored into why this medicine is the number one choice. So overall, you can use any of these 4 medicines. Now, if you're just like, well, I don't want to use these medicines, antibiotics. Do I have to? My answer is, you don't have to. I highly recommend that you do. However, if you find that you're having recurrent infections, it's time for us to talk about other things that we can do to help to maintain the vaginal space, decrease the likelihood of getting the infections, as well as partner treatment. So let's start with the partner treatment. And so I'm really super excited because the data that has been presented in 2025 regarding partner treatment is pretty astonishing. Essentially, the studies looked at women with BV, whether or not their partners were treated. And there was a significant difference in the recurrence rates of those with infections reduced if their partners were treated. And so now, because of this data, we've completely turned the tables. And now we're treating men as well. They don't need to be tested or they don't need a diagnosis. What they need is you as a female having this infection and them presenting to their doctors and getting treatment as well. And we may even be able to write the prescription for your partner so he doesn't have to go through the entire process of going to the doctors, making an appointment, and that can take sometimes forever. We can skip all of that. Your partner can also be treated with metronidazole. And in addition to that, it's also recommended that he uses a topical version of clindamycin. He'll put it on his glands, his penis. If he has a foreskin, lather and saturate the entire area, and he'll do that for just about the same amount of time that you receive your treatment. And at the end of that, the likelihood of having recurrence drops tremendously. So I'm so excited about this information because I think that as in medicine, we're taking a step forward and we're listening to you, believe it or not, and making change. And so I'm excited about that. Outside of partner treatment, there are definitely things that you can do so that you can reduce the likelihood of getting these infections. Boric acid is number one. Remember, we just talked about the pH and how vaginas love to be acidic? Well, boric acid is an acid. And so if BV occurs when our vaginas become less acidic, if we place boric acid in our vaginas, we're providing our vaginas with much more acid, which allows it to become more acidic. It is almost like a no-brainer, right? While we're not treating an infection, we are decreasing the likelihood of an infection occurring, which is why boric acid works as a marvelous maintenance medicine or maintenance drug, more so than a treatment. I always recommend that we get tested first, we're treated with antibiotics. If this is not your first infection or if you keep having them, start to think about using boric acid to help to maintain your vaginal space. Outside of that, it is also important that you eat and have a lot of fermented stuff, kombucha, kefir. These are great probiotics. Increase these things in your diet to help to maintain your vaginal space as well. Outside of those things, it's important that after sexual intercourse that you go to the bathroom and urinate. It's important that we practice good hygiene and let your vagina breathe, okay? It's so important. If we're wearing tight clothing and we're always in a very close space down there, it is hard for air to pass through and to keep us dry and keep us healthy and well down there. Thanks again for being here. I hope you learned something good today. Bacterial vaginosis is very common, but know that if you're having recurrence, we can stop it. It's all about talking with your providers, letting them know what's going on, and really diving into your lifestyle and trying to figure out where we can make changes. Now, if you'd like help and more information about this, I have a free copy of my ebook to offer you today. In this ebook, we're talking about hormones. It's called Hormones Don't Lie. But with that, you have a lot of guidance to help you change your lifestyle, your diet, and all the things to help you maintain your vaginal wellness. If you'd like that, click that link below, and I'll be happy to share it with you. Thank you so much for listening in. Let me know your comments below and your experience with BV, and let's talk about it.